Following a serious patient incident, Peggy Klassen and Dr. Kurt Smetcher identified a gap in the standard of care for surgical patients with obstructive sleep apnea. Obstructive sleep apnea, or OSA, is a potentially serious sleep disorder in which breathing repeatedly stops and starts during sleep. These patients are known to be at a higher risk for post-operative complications. After researching and consulting with other surgical programs throughout North America, the Surgical Patients and Obstructive Sleep Apnea Care Team formulated a clinical practice guideline for surgical program sites across Fraser Health to apply best practice to patient care. This new system of screening and risk assessment identifies patients prior to their surgery and drives post-operative care planning to help minimize patient safety risks. The team also collaborated with other programs such as acute pain services to enhance staff education in caring for patients with obstructive sleep apnea and included patient education and follow-up as part of the overall process. But success didn't come easy. These care guidelines came as a result of many hours of time outside work hours and involved bringing together multiple sites within the surgical program. With change in practice, there are challenges, and with a collaborative approach, adoption of this patient safety initiative throughout Fraser Health is taking place, site by site. Sarah Derman, clinical nurse specialist for acute pain services, has been instrumental with facilitating this regional work. As a result of this hard work, Fraser Health is one of the very few health organizations in North America to have a plan to mitigate risk for these highly vulnerable obstructive sleep apnea patients. Peggy, Dr. Smetcher, and members of the Surgical Patients and Obstructive Sleep Apnea Care Team, for your willingness to see mistakes as learning opportunities, and for leading the way to improve patient safety. You are the winners of a 2014 Above and Beyond Award.